I will now welcome Pam Fonseca, Health Promotion Manager at Heart and Stroke.
Thanks, Kirsten. Hello, everyone. My name is Pam Fonseca, and I'm the Health Promotion Manager with Heart and Stroke based in Halifax, Nova Scotia. And I will be one of your moderators for today. I want to start by acknowledging the land on which I sit on here today in Halifax. It's the traditional unceded lands of the Mi'kmaq people. We're gathered today because of a shared commitment to equity and health equity in particular. So I encourage you to reflect on that and what it means for you and your work and your lives from coast to coast to coast, or wherever you may find yourself as you listen in on this webinar today. Heart and Stroke employees across the country have been working rapidly to bring you reliable and credible information as we navigate these times. If you have not already done so, please find us on YouTube and follow us on Twitter at HSF_science and Heart and Stroke, where we are constantly updating resources and emerging information as it relates to heart, stroke, and vascular cognitive impairment. Heart and Stroke has also created a specific COVID-19 page on our website. And to view this, please visit heartandstroke.ca/coronavirus. You will then be brought to a page that looks like the following on the left of your screen. By clicking on the drop-down menus to view our extensive and ever-growing list of resources. This is also where we'll be sharing and updating the links to our webinar recordings, articles, and resources. As for other upcoming webinars, we have some new topics in the next couple weeks that you'll see there on the right-hand side. We have one next week on April 30th, Managing Transitions to Home During COVID-19. And into the first week of May, we have a French Sex and Gender Differences in Management During COVID-19. And of course, also during the first week of May, it is Heart Failure Awareness Week. So our team is working very hard to bring you some great information for that as well. So stay tuned, and those registration links will be out very shortly. But in addition to webinars, we're also bringing you information in different ways to best suit you. So as noted, be sure to check out all of our different platforms and way to connect with us. So here is our webinar overview for this afternoon. We acknowledge that information on COVID-19 is emerging at a very quick pace, and it is generating many appointment disruptions, issues with access to services, questions and concerns for people with heart conditions. We know that inpatient stays are being shortened, both acute care and inpatient rehab. And with physical distancing and limited outpatient services, access to in-person rehab has become a challenge. And we're hearing from people with heart conditions who are not yet referred, currently starting, partway through, or completing rehab, or who are trying to cope with these access issues and seeking resources and supports to see what's available to them so that they can allow the continuation of their recovery efforts independently. This webinar will offer timely and practical guidance by healthcare experts regarding COVID-19, heart conditions, and virtual cardiac rehab. Today, our speakers will be targeting the following key topics. They'll be discussing practical next steps to take in determining how to continue cardiac rehab and possible transition to virtual rehab during COVID-19. Available rehabilitation and self-management resources that are essential for people with lived experience and their care supporters to continue their recovery at this time. And finally, practical cardiac rehab skills and techniques to practice during self-isolation. And as you also hear from our speakers, we want to emphasize the importance of connecting with your individual therapy and healthcare teams prior to engaging to determine what activities and strategies will be safe and right for you. So I'm pleased to welcome today 4 experts in cardiac rehab that will be sharing some timely information as the world moves to a more virtual means of communicating. And I'll be introducing them further as we go. And then at the very end portion for the Q&A, I'll be handing it off to Heart and Stroke's Director of Data, Knowledge Management and Heart Programs, Cindy. So as a special thank you to our speakers today, again, they're all taking time from their busy schedules to bring us this information. Our first speaker is Romuald Mineyko, a man who has lived experience with cardiac heart issues, and he resides in Nepean, Ontario. Romuald will speak to his realities during cardiac rehab and how he stays motivated and what he's found to be useful in his cardiac recovery. Over to you, Romuald.
Thank you, Pam. I can see myself, so that means that everyone else sees me. My name is Romuald Mineyko, and I'm just a recent patient of the Heart Institute. And it's been a big challenge. Of course, at the start, first 4 days, it was what I saw was this monitor in emergency with my name, and that was the picture. And suddenly my life sort of, I knew that has changed. But what happened? What did I do wrong? And what do I have to do to put myself on track? And that was the big question that was brewing in my mind over this first 4 days to about 2 weeks. And so the biggest question that I had, why that happened? I thought, in fact, that I was invincible. And without yet having the input, other than generic input from the rehab, I started to work on my training. And it was very gentle, very slow, nevertheless included, put me to next to photographs here on this slide. I started to walk and I started to use my spinner. And that was at absolutely base. And I started to alternate between the walk and between the spinner. And that was for another 2 weeks, probably, or more. And only when I had an opportunity to speak to my cardiologist and to speak to a rehab physiotherapist, I got the input. I got the input which helped me to develop the plan. And yes, I wanted to see myself cycling and biking outdoors, but I was definitely not ready because I didn't know what I can, what I cannot do. So that was the beginning of my journey, which really definitely I was very far from being an expert, even in my own life. And this is where, after getting the input from the rehab, I could start to work on the plan. And the first point was to see, where do I want to go? And I referred to my past, and I looked that, yes, this is where I want to be in October or maybe next year. And this is what is shown on these two photographs. But what I really worked on was how important it is, first, to really realize what you can do and really to know yourself, and how rehab and how the Heart Institute can help you with, because you're a new person. And this is where talking to rehab and talking to my cardiologist helped me to work on my next steps. And of course, then you realize that suddenly from a patient, a victim really at one stage, you have to turn into a team member. You're part of a big team, and you have to take your position, and you have to work on, you have to, as I said in this, you have to really get into the driver's seat and work on your plan. And there's a number of tools that I used. First one, which shows in this slide, was really how to develop your condition baseline. And this is where Rehab is absolutely perfect. It provided me with parameters that suddenly, and exactly the same with the input from cardiologists, that now I learn what is my maximum heartbeat, which changed with my medication, and how the medication affects me. So that was the key. And then I could compare and see that, hey, it is different because my life has changed. Then the next step was, how am I going to monitor this basic vitals? And I did in very simple way. It's just I used the chest heart monitor, which is inexpensive tool, and I also used the blood pressure monitor, which I could check under my training, my exercising. And I started to use that. And that helped me to build up slowly my new database, which I had my heart rate. I had my even blood pressure under stress when I was using the spinner. And I noted this. I kept very, very precise log. And then I prepared that for my next consultations with physiotherapists and with the cardiologist. Unfortunately, I couldn't do this in person, and I really believe that that was so very important. But that really pushed me to more focus on information that I have to provide my experts, my team experts, with the information that they can help me. So obviously they did. They provided me with the information which I incorporated into my plan. But what became very important is keeping the record, expressing over the phone, expressing your concerns, expressing your objectives, your challenges. And then, of course, this would change, and this would change from day to day. So because you see that you can increase the intensity of your exercise, then you see different readings. And you have to be prepared to discuss that with your team. So then you have to make absolutely sure that every call, because you cannot be sort of corrected in face-to-face meeting, you have to prepare for it. You have to prepare the agenda. You have to anticipate what you're going to hear from your team members, from your doctor, and for your physiotherapists. And then you have to make sure that you have a list of items that you want to present to them. It is very, very important to have full law of that. And I learned that through the process of going through all this. And it appeared to me very, very clearly that the health team that we have, doctors and physiotherapists, they put so much effort. When I looked at number of people that were helping me already, I realized that I have to step up. I have to take charge. I have to become the member of the team and really follow this. So that was, and honestly, my hero, Arthur Ashe, who was the athlete and long-term patient, he guided me. He was like a guiding light for me at one stage. And this is what he said, and I never ever, this helps me through many things in my life, but this time it was so important. And it is start where you are, use what you have, and do what you can. And you have to be very genuine with it. You have to be very honest with this. And you have to share every step with your team. So this is my main message. And I want to take the opportunity to thank the team, which is incredible and really puts me on my feet.
Thank you, Romuald, for sharing your experience with us.
Direction. Really appreciate this.
Thank you, Romuald. Thank you so much for sharing your experience with us. It takes a It takes a lot of courage for someone to share their personal experiences with us. So we really thank you for doing that with our large webinar audience here today. Thank you. So now we'll turn it over to Dr. Paul O. And Dr. O is the Medical Director of the Cardiovascular Prevention and Rehabilitation Program at the Peter Munk Cardiac Center in Toronto Rehabilitation Institute. He is part of the University Health Network and is an Associate Professor of Medicine at University of Toronto. He joins us today from Toronto. Over to you, Dr. O.
Thanks, Pam. And if we can advance the slide, I'll show you some disclosures. I want to thank Heart and Stroke for this opportunity to have a conversation with all of you. And we're delighted and grateful that so many of you could make time to join us. My main disclosure that I think is a point of a positive is that we do hold some grant support from Heart and Stroke. We're very engaged with research, and we're also very engaged and appreciative of these sorts of connections through the community. Next slide, please. The purpose of the next 15 minutes or so is to describe the importance of connection and how cardiovascular rehabilitation fits into that, certainly in this time when things have changed during the pandemic. And if there's a few things that we can take away at the practical level, let's describe it in the course of this discussion about what to do if you do have some symptoms. How might we best communicate, building on the fantastic advice that Romuald already gave us, and a little bit about accessing useful information that will be amplified further in the speakers who will be following. Next slide. So a word about social distancing that has become a pervasive new term in the last month. And if I bookend my few minutes with you on kind of ways to keep your heart healthy, I'll start with this one in terms of prevention is the biggest thing that we can do. Although we're talking about rehabilitation, perhaps in the context of this session, the best thing we can offer to anybody is to try to prevent an infection from catching on in the first place. And these sorts of items that come from the Ottawa Public Health in terms of a graphic of staying separated physically and not congregating in groups, and doing things like online engagements, which we are doing with right now, protecting our vulnerable, and learning, I think is a great preamble to where we're going. Next slide talks about how we can think about this term of social distance and perhaps view it in a different way if you'll advance the slide. And when we first heard the term social distance, I think many of us reacted and thought, click again, that social distance really isn't the term we're interested in. That in fact, at this time, even more important than ever was for us to stay socially connected, but physically apart. So we are grateful that indeed you have joined us, and there's close to 600 of us on the line today. Next slide, please. So we're going to talk about why cardiovascular rehabilitation is important. And there's been a whole series of reviews in the medical literature that say that if we can get into programs after experiencing a heart event or a stroke, or living with many chronic conditions that might put us at risk for heart disease, there is very strong evidence for the benefits of these types of programs. And this can be realized with lower risk of dying from heart disease and stroke and ending back up in hospital. Next slide is a graph, or is a nice kind of fun image of a time before COVID-19. Obviously, the folks shown here are not socially distancing, and hopefully we'll get back to that place again where we can actually come together physically. But to remind us that cardiac rehabilitation is importantly about physical activity, but it's also about the other activities that are important for our health as a whole. So mental health and social connection. And the goal is that if we can get all of these things working in the right direction, as it did for Romuald, then we can live as positive a life as possible in the community. Next slide, please. So this would be the components of a standard cardiovascular rehab program across Canada and around the world. If you are going to go into a center at a different point, then these are the things that we would be offering you. One part will be a structured physical activity and exercise program. We'll hear more about that from my colleagues. In the middle will be, how can we engage together so that we can become the directors of our own health, as Romuald has already told us, and touch upon medical, exercise, nutrition, and psychosocial issues. And then the third major pillar in my mind is that we should engage together in therapeutic education, not just reading things, but actually working on education in a accessible way, addressing literacy, so that it might actually change behavior and that then transforms into better outcomes down the road. So that's the model that we would apply in a standard fashion. Next slide. And this would be the usual pathways that we would see in operation prior to COVID-19. That is that a person with a lived experience might end up in a hospital or a clinic, having undergone testing, intervention, hospitalization. You'll go home, or possibly a few people might be sent to an inpatient rehabilitation center. And then there's a major ongoing interaction between the rehab center and the person living at home, as Romuald has described, where you're going to develop a real collaborative, cohesive team relationship to work on all of those factors that we've just described. Next slide shows how things are actually going to be different in the new world. So we see here what's meant to be displayed is that, you know, far fewer people are going to hospital right now for heart events, surgery, angioplasty, valve replacements. Indeed, people might even be afraid, and some of you on the phone might be feeling concerned, gosh, I don't want to go to hospital because something untoward may happen. I'll just tough it out at home. One thing that I'll come to at the end of this and emphasize it, that's probably not the best idea. If you need help, get to the hospital. They're open, they're available, they want to see you. But what it means in this pathway, though, is that there are probably fewer people that will be leaving hospital to home, as well as leaving hospital to the rehab centers, just because of overall reduction. For people who do end up in hospital, as Pam introduced, probably you're on that trajectory to get home much, much quicker, and there's less time in the hospital for us to have this engagement. And then importantly, the other major change we've seen and experienced is that there's reduced connectivity, at least from a face-to-face perspective, between people living at home and the rehab centers. And that, of course, now sets the stage where we need to come up with different sorts of solutions. And if we advance the slide one step, that this is where virtual models of rehabilitation using internet, video conferencing, email, or just the good old telephone it has been developed and promoted and utilized widely in many programs across this country to fill that gap in connection and provide all of those key elements of rehabilitation for all of us. Next slide, please. So this has become commonplace for many programs, and currently across Canada today, there will be thousands of people who are living with heart conditions or stroke or risk factors who are connecting with providers through some sort of virtual care methodology. Next slide. And how might the components of cardiovascular rehab kind of shake out? So if you are actually in a virtual cardiac rehab model with engagement with a team, and we think about those three major components of structured exercise, behavior, and therapeutic education, this is how you might be participating, or how we might be encouraging you to participate. With your exercise, we want you to continue the exercise prescription that you received from your team, but we'll want you to do it either in your home or close to home in your community. And so you may know that you're walking a certain distance and a time at a pace with a certain heart rate and a certain level of exertion. That's terrific if you've received that advice on how to do that aerobic and resistance type of program. If you're not doing this, then we'll follow with a slide in a moment. And we might want you to maintain a frequency. Like 5 days per week seems to be a really good level for us to strive for to improve cardiovascular health or maintain it if we're already at a good level of activity. And then very importantly, we'll ask you to monitor for symptoms. How are you feeling? Are you developing any chest discomfort or shortness of breath or dizziness? And please report that into your team. Don't hesitate to do so if you're feeling in any of those ways. For helping with behavioral engagement, we'll be in some sort of program with regular frequency of calls, either by phone or connections by email or video chats. We should certainly look at the exercise physical activity programs, review those symptoms that you've been monitoring, and then every week or two set up some goals and actions on where you want to get to. Of course, we'd all want to be striving for a healthy diet, sleeping well if at all possible, but we recognize this has been quite disruptive. And we're going to stress, but can we stress less and stress positively? It's what you do with the stress that's probably our key way to surviving well. And then on the therapeutic education side, undoubtedly you're engaging with your healthcare team with some structured as well as unstructured education, and you might have a suite of resources that you're able to access, as well as engaging in online learning and webinars like the one you're in right now. Next slide talks about what if you actually don't have an engagement already with your cardiovascular rehab team. What might be some of the things that you can do under these same three pillars? Well, in the structured exercise or physical activity program, the guidance might be, or the goals might be, stay active, sit less and move more at a reasonable pace, and some activity is better than none, and you can actually achieve great health benefits from doing so. And the emphasis might be on developing a pattern. Can we get out for 10 or 15 minutes a day, or can you be active in your home or on your balcony or in your backyard for 10 or 15 minutes a day? And Jennifer is going to follow shortly with some top 10 tips on how to do this. For your own behaviors, how can we set a pattern and get used to your new normal? Learn something about goal setting and action planning that is probably quite instinctual to us. But if you wanted to do something, then we have a series of what we call Thrive videos on our website, and I'll show you that in a moment, about how you might do some goal setting and action planning in a meaningful way. And if you want to get connected, check in with your local or regional cardiovascular program about where there might be opportunities to engage in cardiac rehab if you feel like you're missing out. And each day we get calls from people who say, you know, I've had a procedure, I've had an event, and I'd like some advice. And we're happy to provide that structured advice for you. And then on the education front, this might be a little bit more unstructured, but there are lots of resources that will be shared during this conversation as well as afterwards in the posted materials. Join those webinars and communities. And in our program, we've started a daily education session at 1 o'clock called the Cardiac College Online. And I'll show you that in the next slide if we could have that up, about a couple of these opportunities. So if you go to this website and join the Cardiac College Learn Online every day at 1 o'clock from Monday to Thursday, you'll join in with other audience members across the country as well as internationally. And one of our team members from our program or other programs like in Ottawa will lead you through a session about heart health. And then at the same website, you can find this Thrive kind of activity where you can learn how to set an action plan. If you find that that worked well for you, you can choose from one of other 12 different options on exercise, healthy eating, taking medications, managing psychosocial stressors, and doing really well. And you could set this up as a fun goal of 1 or 2 of these things per week. Next slide, please. So, I think we're showing you that there's lots of options for you. So let me bookend, as I said, by talking back about coronavirus. We said the first key was for prevention. A next point is about self-monitoring. And we've all heard so much about watching out for coronavirus. And, so if you are feeling things like fever or cough or shortness of breath that's unusual for you, then don't hesitate to seek out care. And I think that's what the Public Health Agency of Canada is telling us. And the next slide is, so we're watching out for COVID, but please don't ignore your heart either. Unfortunately, we're hearing too many stories about people living with heart conditions who may be more fearful of contracting COVID-19 than the bad effects of the heart disease. And if we delay unduly, this may lead to actually worse outcomes. So we're hearing about people that may not go to hospital for hours or days after experiencing a heart attack. Remind you that getting to care sooner will lead to better outcomes. And we encourage you to seek medical attention if you have questions or if symptoms are unstable. And if you advance the slide, then this is a nice graphic from the Canadian Cardiovascular Society that really implores all of us to not ignore heart symptoms, especially if you have an underlying heart condition, reminding us of what a heart attack might look and feel like, for instance, and 911 is there to help you out. Last slide, please. Or actually, that is my last slide, and I'm happy to pass the baton over to Gordon.
Thanks so much, Dr. O. Those are some great resources you shared for everyone to seek out with Cardiac College and the message around not ignoring your heart symptoms. So thank you for sharing those. Our next speaker is Gordon Fogg, and Gord is a clinical exercise physiologist based in Winnipeg, Manitoba. And he's here today to share some information on how to adapt cardiac rehab efforts and where you can access some more further information on this as well. Over to you, Gord.
Thanks so much, Pam, and a big thank you especially to the previous 2 speakers. You've already covered a lot of the important information that I'm maybe going to frame a little bit differently. My experience is mostly in delivering, or I'm here today to speak to my experience delivering home-based cardiac rehab, including sort of before the COVID era. So a couple of different perspectives, hopefully, that I can bring. I potentially have an honorarium, not sure exactly how that's going to work out, but otherwise I have no disclosures and nothing should create a conflict of interest in the presentation today. Next slide. So as you've probably already become aware, or the other speakers alluded to, some things have had to change with COVID entering the picture. For programs across the country, this generally means a shift to virtual delivery, and depending on the size of the site and available resources, some programs may not be operating, but there are a number that still are. Group education, some of those pillars that Dr. O mentioned earlier, is still being provided for many people, either through online webinars, as we see with University of Health Network, or more static resources available at websites and through apps and such. One of the big differences that some people may be wondering about, as well as screening and assessment, is changing, and people are trying to adapt with that, so that may be different from the past. And as well, the main difference that you'll see in terms of how you interact with your providers is frequently going to be that you'll be speaking with them over the phone and having phone call follow-ups or through some sort of online virtual software. Next slide. So that being said, there are some core things that really haven't changed. The pillars of cardiac rehab are largely going to remain the same. And fundamentally, a healthy lifestyle and appropriate medications are still going to be one of the most important ways to help to manage your cardiovascular condition and help to prevent future cardiac problems. So that stays the same. Conversations that you have with your rehab professionals, if you are participating in a cardiac rehab program, may help to increase your confidence and alleviate some of the concern and fear around any exercise that you may be feeling after a cardiac event. And an important thing as well to note is that physical activity is generally, with a few exceptions, but those are quite uncommon, physical activity is very safe, especially when you're engaging in light or moderate intensity physical activity that we tend to encourage. You know, the move more, sit less, any is good, more is better are some of the phrases we like to use. And that's going to support as well good physical as well as mental health, which is, you know, particularly important in this era where a lot of us are more socially isolated or staying inside a little bit more. And sort of the trick that most people are really going to kind of figure out, and as Romuald pointed to earlier, is that it's important to start where you're at. You know, try to assess what you're able to do currently. That doesn't necessarily have to stay the same moving forward. You may be able to progress gradually in small increments, bit by bit, and over time that can add up to be quite significant. Next slide. So, all that being said, how can we adapt? What are some of the things that you should know or be asking your cardiac rehab professionals, for those of you that are involved in a rehab program, or if you have access to other resources, maybe a family doctor that you're chatting with or following up with? Some of these questions might be helpful in those encounters as well. Some of those things would include, are there things that I should know about my heart condition, or what is my heart condition? What do my medications do? You know, why am I taking them? What are they helping me with? How can I reduce my risk of future heart problems? Are there things that I can change or modify? We talk about those as risk factors. And where can I get additional support for diet and mental health, etc.? Again, regardless of whether it's your family doctor that you're speaking with, or if you're part of a cardiac rehab program that may have changed formats, some programs will still be able to offer some dietitian appointments or workshop or resources with a psychologist virtually. So it's important to ask and get to know which resources are still functioning for your program. And around exercise, it is important to ask for guidance and get to know your individual condition and make sure that specifically, are there any activities that you should avoid or anything we should limit how hard that you're pushing? Because that may be the case. And again, please do speak with your healthcare provider before pushing harder, trying, you know, significantly new activities. And as well, asking for some guidance on how to progress. You know, here's what I'm doing right now. What can I do to get a little bit more fit, or, you know, I'd like to be able to do more. How can I accomplish that? Would I benefit from additional types of exercise? Often we encourage people to start with just walking and something very manageable, but it's important as well, especially when we're not going to a gym environment, to remember that resistance training, which the guidelines recommend 2 to 3 days a week for most people, is still important. Balance training, flexibility can come into the picture and be very important as well. And with those, are there any additional safety considerations that you should potentially be following? And the last question that I encourage you to ask, and I would really strongly recommend to everybody, is can I keep doing the things that I'm already doing? Not so much because I think you shouldn't or you should check in to make sure that it's safe, but more so because I think that question can spark a conversation. And having a conversation where, as Romuald pointed, the importance of monitoring and logging your behavior and really communicating effectively with your care team and your rehab team, that's really kind of one of the magic pieces that helps to drive cardiac rehab. So keep track of what you're doing. You can use a calendar, an exercise log, a Fitbit, etc. I'd encourage you as well to set goals with your care team. Make sure that they are specific, measurable, attainable, realistic, and time-bound. Vague goals, even if they're well-intentioned and outcome goals, can help, but really we want to know what we need to do tomorrow. So specific, measurable, if it's 2 laps of the hallway, or I'm going to start it with just a 2-minute walk this week, or on Wednesday, or this afternoon. Try to really hammer it down into a plan. Next slide. And as well, information is fantastic. It can help to provide a lot of comfort and reassurance. It can be an important source of empowerment to move forward and understand what happened. So the Heart and Stroke Foundation is fantastic. Some of the resources, I love Living Well with Heart Disease. It's a paper resource, but it's also available online, and it's fairly succinct and works quite well. Living with Heart Failure is fantastic for folks who have heart failure. Check the website of your local cardiac rehab program. They may have resources available online or information. And University of Ottawa Heart Institute has a great site, as well as many programs are referring to University Health Networks, eHealth University, or Cardiac College. And I think that's about my time, so I'll turn it back to Pam. Thank you.
Thanks, George. Thank you for outlining some of those key questions that people can ask their healthcare team. I think that's really important as we all adapt to these changing times. So thank you.
Welcome.
So
Thank
our
you.
thanks. Our final speaker today is Jennifer Harris, and Jennifer is the manager of the Cardiovascular Disease Prevention and Rehabilitation Outreach Programs at the University of Ottawa Heart Institute. So over to you, Jennifer.
Thank you, Pam, and echo everyone's thanks to my fellow panelists, to Heart and Stroke for hosting this really important topic, and to you, the audience who's taken the time out of your day to do a little bit to help your health. So great that you're here. I don't have any conflicts of interest to disclose. And so really what I'll do today, as we wrap up this session, is try and sum up what you've heard from the last 3 presenters by giving you some very practical tips on how to be active during this time. So the first of those tips is going to focus in on aerobic exercise. You heard this referred to, and what are we talking about? We're talking about getting your heart pumping a little bit over what it normally pumps at rest for a sustained period of time, ideally in bouts of 10 minutes or more, but important to do what you can do. The idea here is that you're aiming to do something repetitive. A great example is walking. This is a perfect example of aerobic exercise. But you can also do aerobic exercise inside your house. Certainly you can walk around. Also, there are lots of videos online. If you're trying to figure out where to start with a good exercise video, you will find good resources at those websites already mentioned. The Heart Institute has a COVID-19 resource section, as well as the Cardiac College. So good places to start if you haven't yet found some online resources for doing aerobic exercise. Of course, in addition to that, we do want to be doing resistance exercise on the next slide. And again, you heard this referred to by all our speakers. It's really important to incorporate working your muscles with strength exercises in addition to working your heart muscle. So you can use weights, as you see in this picture, but there are lots of easy ways to do strength exercise without any equipment at all. For example, just standing up out of a chair, repeating that 5 to 10 times is a great strength exercise for your legs. And by doing a push-up against a wall or a table, that's going to be strength exercise for your arms, chest, and back. Again, another great thing to find online would be other examples of resistance exercises that you can do with very little equipment, and you will find those on the websites we already referred to. And as Gord mentioned, we want to be aiming to do this kind of exercise at least twice a week to strengthen our muscles. And on the next slide, we'll talk about balance. No one is ever too young to start working on balance. It's another really important piece of your overall fitness. And the key to working your balance is to challenge yourself. So it needs to be an exercise that's difficult for you to do in order to improve your balance. And the key there is to be safe doing it. So find a spot in your house where you can challenge your balance, but be safe at the same time. So for example, in the corner of a room or at a counter or table where you can easily grab on if you do lose your balance. So things like standing on one leg, if that's easy, standing on one leg with a little knee bend, and or trying around with closing your eyes, whatever it takes for you to challenge that balance a little bit in a safe situation. But again, even though we talk about the fact that we need to incorporate different things, we really want to send this message home, and the other speakers referred to it as well. Any of the exercise you do, no matter what form it is good. Yes, our guidelines talk about trying to do 150 minutes every week of aerobic exercise and strength exercises at least twice a week. But the research has shown us over and over again that all exercise is good for your health. And so just doing a little bit is really important. And as Dr. O mentioned, trying to be systematic about it, trying to plan in specific exercise sessions or activity sessions and increasing it systematically. On the next slide, we are reminded that tracking our progress does really help us stick with our plan. So, and Gord referenced this, making a goal and then tracking your progress towards that goal. Sometimes we have great intentions for doing our exercises and we can even get started with it and then we sort of fall off the map. And for sure, it's been shown that if we can document our progress and write down our goals, we may have a higher chance of sticking with it. So ways to track your progress, simple pen and paper, as you can see here. Some people like to see it on a calendar format. Of course, there are many wonderful devices like pedometers that you wear on your waist, or Fitbits and Garmins and all kinds of things we can wear on our wrists. Also, online tools are great for helping us track our progress, and they can sometimes give us very nice visuals to remind us what we did do or let us know what we didn't do. So there's lots of different ways. Tracking is really key. On the next slide, we will emphasize the importance of warming up and cooling down. So this is one thing that's extra important, especially in the context of maybe not having as much supervision and or in-person exercise sessions. You really want to take the time in your exercise session to warm your body up. This helps warm up your muscles and joints as well as your heart. But it also gives you that time to check in with yourself and listen to how you're feeling. So that day, perhaps you may not wish to go any farther than your warm-up speed because your body's telling you this is just enough. But perhaps it's a good day, you're feeling great, and you want to take it up to that more moderate intensity, but always by starting with a warm-up at first. And a warm-up can include very structured stretches like you see in this slide, but it can also just be very light exercise, gradually building up to that higher intensity of exercise that you were aiming for that day. And again, finishing off your session with a cool down for the same purpose. Listening to your body is really key, especially as noted during this time where you may not have as close a connection with the healthcare provider. But that said, it's reporting what your body is telling you to the healthcare provider during any virtual sessions you may have. And Romuald told us how important that was. So you need to be especially in tune with how you're feeling when you're exercising, thinking about what your body's telling you, and be able to report that back, because that's how they will help guide you in either decreasing or increasing the advice they're giving you, but also for you in the very moment. If you're feeling good, that's great. It's green light to continue what you're doing. But if your body is saying things to you that aren't so good, that's a great indication for you to slow down, stop, depending on what your body's telling you. So just really key to be really tuned into what your body's telling you. And that leads us to the talk test, which is on the next slide, which is a really helpful tool to help decide if you're at the right level for exercise. We want to make sure that you can talk without having to stop to take a breath. If you cannot, that's an indication that the exercise is too hard, especially at this time if you haven't had an in-person assessment with somebody to let you know that that level of intensity is safe. But on the flip side, in keeping with one of the things Gord said, we also want to make sure you're making good use of the time you spend. So if you can sing when you're exercising, perhaps that's the sign for you to take it up just a notch, so that you're working a little bit harder. We do want you to get good value out of your activity session. And finally, just a reminder that connecting in socially is really important. In normal times, we would encourage people to be exercising in groups because we know how many benefits come from those social connections. Of course, right now, we're not exercising in in-person groups, but there are many different ways to connect virtually, and we really want to encourage you to do that if you haven't already. Whether it's the telephone, email, internet, this is really, really key to staying healthy. And finally, wrapping it up, this is a message you heard from each of the speakers, just really important to be sitting less and moving more, breaking up long periods of sitting. Even if you're exercising for half an hour every day, you still need to be moving more throughout the day and avoiding long periods of sitting. And that's a really easy thing to do by standing up or walking around, but one just needs to be mindful of it. Thank you.
Great, thank you very much for all this presenter. It's been great to have all of you share very different aspects of your experience. So we have a lot of excellent questions, and we'll try to get through as many of them as possible with the remaining 7 minutes. So the first question directing to Paul, especially about the referral to cardiac rehabs. So one of the questions was that individual may have limited access to, or ability to reach their patients. And any thoughts on how to do physician or physiotherapy assessment remotely?
Great, thanks for the question. And coincidentally, I was on a call earlier with Jennifer and several colleagues about this as well as other issues. First of all, I think we acknowledge that one, it's important to continue to see people at this time because there are many individuals who are waiting for some sort of advice. And the ideal situation of face-to-face and stress testing, et cetera, that just isn't on right now. The other framing piece is that we would want to provide advice about being active as opposed to maybe structured exercise. So set your expectations appropriately on both sides. You can get a lot out of a conversation, whether it's on the phone or through some video conversation, about where a person is at with respect to their heart condition. Is anything unstable, any red flags going up around heart pains, arrhythmias, heart failure? Or are there any other red flags around exercise in general, like arthritis or motor deficits? If all of those questions are okay, then I think we could feel comfortable moving forward to say we can start to get active. We can sit less. We can move a little bit more in a light to moderate sort of activity. Look forward to some guidelines about how to do this further, and that'll be coming out in the next week or two.
Great. On that note, I open up also to the audience. There's actually a question about would there be usefulness to have national guidelines? So I think, Paul, you just answered that question, and I can see on the screen that all of you guys are nodding. Gordon, Jennifer, any thoughts about a national standardized guideline?
Yeah, I think it's a great idea just to help have us standardized guiding principles to sort of move forward in this time that's very, very different than what we're normally working with. So I think informally, many of us are sharing with each other. We do have a good national connection for the most part. So I agreed, it's a great idea.
Wonderful. The next question is for Romuald. Thank you very much for sharing your journey and your life experience and all those fabulous pictures to show us, how you tackled, your journey to return to your active lifestyle after your heart attack. So one audience have pointed out that in addition to cardiac rehab, what is very important is peer support, getting the peer support you need to help you through your journey. So the question to you is, A, did you have any peer support? And B is, what would be your advice on seeking peer support?
Yes, thank you very much for the question. And yes, it is very important. I was very fortunate that I had support from my wife, of course, and from my daughter, Alexandra, who lives in Calgary. And I had number of phone calls from my daughter who would help me with questions. Let's say before the appointment, my phone appointment with PT, she would help me with the questions. Even my first appointment with the doctor, when I was still not really functioning that well, she contacted me and she drafted a number of questions for me. Then if you have someone like my daughter that knows you very well, she can put you on track. You're thinking that, yes, you can do exactly the same what you were doing before, but this is not necessarily the case. And she can put you back on track. If she's biking with you, she knows what you can do, and she knows at the same time what to expect. And it is very good to hear from somebody. So close friends, family members, absolutely essential.
What a great advice. It's almost like having someone to check over your homework, right? As you talk about the plan and the log is so important.
Absolutely.
Great. A quick question for Gord. Our cardiac rehab patient can't get in for stress tests, and we are using the Borg scale for exertion and talk tests, as Jennifer have mentioned in the talk. But that is not effective for everyone. Any ideas and thoughts or opinion on that?
Yeah, I mean, without knowing more detail, it's a little bit challenging. I think Paul kind of mentioned some important considerations, like watching out for any red flags that might come up during exercise and ensuring that it's happening safely. We'll often provide as well education on what exercise should normally feel like and what is not normal, so that education can be important as well. And I mean, the RPE and talk test, if it's not really working or sinking in, really just emphasizing what we want people to do is really to, again, move more, sit less, and focusing on kind of just engaging in regular physical activity without kind of focusing too much on, getting to the point of running a marathon or anything. Just emphasizing that any activity is good. And that's going to vary from setting to setting and what resources people have, and things like that. So I don't know if Jen has any additional insights to offer.
Yeah, I completely agree. And I just think for those programs or places where there is the capacity to have those one-on-one conversations, I think Paul alluded to this as well. There's a lot of information you can gather by having that conversation, but recognizing that not everybody has the capacity to have that. And that's where those online resources can be a good fallback, where it's giving you that practical advice without having that individualized assessment that talks about how to monitor your exercise, where to safely start, and just moving more within safe recommendations.
Those are all great advice and very practical. Unfortunately, we are out of time. So I just want to take this opportunity to thank all the speakers in the audience for joining us today while we're practicing physical distancing. We do have a long list of questions that we were unable to address, unfortunately, but as Paul have mentioned, there are the daily webinar from his organization that is offering, and there's many different channels that we can reach out to all these experts and people with lived experience here. So I encourage everyone to keep asking those questions. An informed individual to ask questions is going to always be also helping our healthcare team to better understand your needs. So that is very important, and reach out to us, heartlandstroke.ca as well. Should you need to submit your question, and we'll be happy to connect with the expert and people with lived experience to get your question answered. Over to you, Pam.
Yep, that concludes our webinar for today. So thanks everybody, and I hope you all have a great rest of your day.